Anyone who has ever suffered the misery of back pain knows how urgent it is to get relief. Once you are free from the pain, most people will learn as much as they can about their sore back to try to prevent back problems from arising again. Back pain can vary from person to person, type to type, and region to region, such as the upper, middle and lower back. It can be a dull, constant ache or sudden sharp pain like a dagger that makes it almost too painful to move. It can start quickly if you fall, get a sports injury, or lift something too heavy. Or it might worsen over time, getting progressively worse. One thing is for sure, the pain is a memorable one, and the majority of people will experience it at some point in their lives. Back pain can occur for a range of reasons that are either structural, musculoskeletal, nerve-based, or a sign of an underlying disorder. Most back pain is structural or musculoskeletal, and the nerves can be affected by changes in the structure of the spine. The spine is a complex system of interlocking bones and joints called vertebrae. The spinal column extends from the base of our skull all the way down to the tailbone at our pelvis, the coccyx. The many vertebrae that make up the spine are labeled in terms of area, and each is given a number so that all doctors know which they are referring to if there are any issues with the back that need to be dealt with. Most people experience lower back pain. Up to 80% of the population will have it at least once in their lives, but what are the main causes of back pain? Anyone can have back pain, but some things that can increase your risk are poor physical fitness, overweight, heredity, smoking tobacco, sitting job. Sometimes the cause is very obvious, such as an injury. In other cases, the pain is real but might require a process of elimination to determine where it is coming from and why. There are a number of natural remedies for back pain. The good news is that many of them are free or inexpensive. Their effectiveness will depend on the location and cause of the pain, but these should in general work for the upper, middle and lower back. Yoga for stretching, increasing flexibility and improving core strength. Try plank pose. Getting enough sleep. Aim for 8 hours each night of high-quality sleep. Sleeping on a bed that gives your back enough support. The mattress should not be too soft. Making sure you are walking properly in good shoes, avoiding high heels, and taking care of your feet. Having a supportive desk chair. If you're like most people, spending hours at a desk every day can take its toll on your back if you are not careful. There are a number of effective pain-relieving medications, from over-the-counter to prescription. They vary in strength, results and potential side effects. Your choice will depend in part on how painful your back is. Most doctors will ask you to rate your pain on a scale from 0 to 10, with 0 being no pain and 10 being extreme pain. Depending on your pain rating and the suspected causes of your back pain. Whenever taking any pain relief medication, be sure you discuss all potential side effects with the doctor. Take it exactly as prescribed, on the correct schedule, in order to avoid accidental overdose. If self-care, natural treatments, over-the-counter and prescription medications are still not enough to offer you pain relief, or your back pain has persisted for more than 3 months, or has a clear structural reason, it might be time to consider your surgical options. Each type of surgery offers a number of benefits, but also poses certain risks in addition to the usual ones of surgical site infection and complications from anesthesia. Learn as much as you can about the surgery, reasons for it, alternatives, and expected outcomes so you will be fully informed before agreeing to the surgery. Acute and chronic back pain can impact all aspects of your life negatively, from your relationships with your children and your partner, to personal finances, to your job and career prospects. Back pain can affect your sleep patterns, mood, and enjoyment of life. Fortunately, a good deal of this can be prevented if you take care of your back so it takes care of you. Back pain is a fact of life for many, but it doesn't have to ruin your life. Practice good self-care, use natural remedies over time, and work with your doctor to find a range of effective solutions to help heal your back and strengthen it for better back health.